Hello, good morning, everyone. Thank you for joining us on Monday morning. Um, I'm going to cover some of the basics around public and community involvement, as Tracy said. There's so many different people in the room, and depending on your experience, the information that you really need will be very different. So I'm going to give you kind of just the overall kind of information about how the NIHR describes and looks for involvement in research. And then as we develop our sessions, we will go into more specifics in the future and how to do some of it. So straight on, the NIHR defines involvement, public involvement, as research being carried out with or by members of the public rather than to, about, or for them. So it's a really important distinction that it's about involving public involvement, and community involvement is about involving people right throughout the research and not just seeing them as it being put in a box in one particular part of the research process. And then they also define helpfully participation, and this is where researchers often get confused between the two. And participation they describe as it's where people actually take part in research. They might be people might be a research study, take part in a clinical trial, take part in a survey, take part in a focus group, and that's kind of they're helping gather the data and being the participant to gather research data. And when they talk about engagement, they talk about that's really about communicating information from your research, feeding back. And when they talk about being public involvement and community engagement, it is about engagement of the public. So that doesn't include going to, say, writing an academic journal article or going to a conference, academic conference, because the public aren't in those spaces often. This is about going to different community groups or finding different ways to contact the communities that have been involved to let them know the outcomes of the research. There are so many different names and descriptions involved in public and community involvement, and this is just a selection of the acronyms you might have heard, or the ways that sometimes maybe you've described your research as well, or you're thinking about planning your research with some of these elements. And this is where I'm not going into detail of any one of these particular particular activities, but I think it's just important to know that they all kind of are encompassed in involvement and involvement and engagement. In local authorities, we often hear the term community engagement being used, as there's often a community engagement function in local authorities. And I suppose that the difference is for research purposes about involving people right throughout the process and not kind of going to them and then taking that information away. This is a really, really helpful slide from the ARC, the Applied Research Collaboration in the West, an NIHR infrastructure organisation. Now, there are many iterations of this image, but this is really just trying to show you that the kind of the way that people can be involved right through each of the research through the research cycle. So right from identifying what your question is, involving people in deciding that and making sure that the priorities that you've decided are actually the priorities for members of the public or community groups that you're working with, and they can help you design your research and make sure it's going to be fit for purpose, and participants from their background will take part. They can help with the grant application. They can be a co-applicant, you might have heard that term, or they can be a PPIE lead in your application, and they can be part of the recruitment process. They can help to analyze the data. They can definitely help with telling you where to go and communicate and engage people and disseminate your findings. And they can also be they should also be part of the evaluation, and then this kind of whole cycle kind of starts again. But we think it's a useful image and a useful way to think about how you can involve people at every stage. You can sometimes hear it called as research layers, or it gets called PPIE layers, and this is what we mean, all the different activities that they can be involved in. And I think as our training sessions develop, we'll probably pick a lot of these sessions and do specific training elements of that and explain it. There are different frameworks to kind of try and pin a lot of the involvement in. We haven't found one yet that we're completely happy with, and the Specialist Centre is looking to perhaps create a version of one of these which maybe sings a little more to the way that local authorities do involving the public. But I thought it was useful to see some of these colourful images and colourful theories of how you can involve people, and the ladder of participation being from the 60s. That kind of, in the 60s there was a massive surge in service user voice and involvement, and that's kind of I suppose, even though some of the words are a bit extreme on that slide, there is some elements there that kind of still hold true today about involving people in your processes. Just a very brief word on what is not public involvement again. So I often, when I'm talking to researchers, I often see them getting confused between what is their participation activity and gathering people's experiences and views in comparison to the involvement, and they kind of get conflated a lot together. So I think the really important thing at the bottom of here is, what is the question you're asking and what will you use the information for? So you can ask a community group or public about their experience of a condition or an experience of housing or air quality or food security or whatever it is. But if you're going to then use that information of that experience to inform how you're going to do the research, then that's involvement. But if you're just asking to kind of find out about them, that's all straying into kind of the data to inform the research. An example would be where you meet with a community group and you ask their opinions about, let's say, take food security, and you go and have a focus group at a food bank and ask them about how they experience, how they kind of interact with the food bank when they come. That might be helpful to know timings to then go and do your collection of surveys at the food bank if you were collecting something around food security. But if you were just asking them what's your experience of using a food bank, and you're not going to use that information to then inform how you do your research in any which way, that isn't involvement. I've already mentioned types of engagement are not academic journals and conferences, although they're very, very important for the so that we don't have research waste and that we learn from research. It isn't achieving the public goals of it. So you do need to think about what community groups you would go to, what kind of local media to use to get the research findings out there. And that point of this is not a one-off. Involving people is not a one-off, kind of go at the start and go at the end. You need to think about ways that they can be involved throughout the process. Just a very quick call out for the UK standards for public involvement. If you haven't heard of them already and you are involved in the NIHR and seeking funding from the NIHR, I would very much go and look at these, and we do have a link. They are the kind of principles that NIHR expect everyone to follow when they're doing involvement. Just a quick message that a common question we get asked is, do we need ethical approval to do our involvement? We're very clear that you don't need ethical approval to do involvement, because it's all of the pre-award development primarily, but that you should do it ethically. And there is some fantastic guidance that was produced by the ARC in the northeast, North Cumbria, and that's available on the link, and we will send that. This doesn't, I suppose, if you are confused about ethics, you do need to seek kind of formal guidance, because there are some examples where you have, for instance, if you're involving a group of your contributors in peer research or community involvement, they're going to be involved in maybe analysing the data that you get or collecting the data. Those kinds of activities do need ethical approval in the overall design of your research. Very quick mention around research inclusion. NIHR talks about research inclusion now, not EDI, equality, diversity, inclusion. The terminology's changed recently, and I think a lot of the speakers today are going to talk about these elements of research inclusion, so I'm not going to kind of labor them, but I think it's really important that you consider it in the planning of your involvement activities, and how you're going to make sure that you're getting to voices that maybe aren't being heard, and how you can go about doing that. And that will take time, and it will take resources, and it's important to make sure that you cost that in. And we're looking to do some cultural awareness and humility training sessions, hoping to develop them. So we hope that might be useful to raise awareness and support you in your journey around research inclusion. A quick mention for evaluation as well. It's very important to think about how you're going to evaluate the difference that the public will make in your research, and how they will how those involvement activities are going to make a difference to you in your research, but also how you can then feed back to those contributors so that they know how they've made a difference in your research. An example, for us at the centre, we monitor all of the different activities that our public contributors get involved in, including this one, because Rick is one of our board members, public contributor board members, and we will be, for each of them, we'll be looking and then evaluating how has that made a difference for both the contributor and also our research activity. If any of our researchers ask for plain English summary input, we'll ask them for feedback on how they've actually used that feedback from our contributors to change either the wording in their plain English summary, or sometimes how they've slightly tweaked their design of their research based on that feedback. And then that's really useful learning and understanding for our contributors, that they haven't wasted their time, that they were listened to, and that they could hear what was said. If you organize a PPI group, or you have a different, you do some activities, a very simple way, if you don't want to use one of the kind of models or methods, is the you said, we did approach, where you say, you do a summary of what you said, what they said, and then how you've used it. And we often use that approach when we're doing kind of one-off activities during the centre's work. There are a number of evaluation models. I'm not going to go into detail, but a quick plug that on the 29th of May, we are having a meeting, another session where we're going to be, got some speakers talking about those. Payments for NIHR, they expect contributors to be paid
2
for
minutes,
their time.
Kasia.
Okay. Thanks, Tracy. It can be really, really tricky to pay people. Newcastle University is not immune to this as an organisation, but whoever your organisation is, and you're doing involvement activities, make sure you find out what the payment process would be. We've got some guidance there. Importantly, contributor roles are not classed as employment, and they're not classed as volunteering either. So it's a tricky area to kind of cover, but one that you should make sure you're covering. Then just a summary, some basics. Make sure you prepare. Public involvement and community involvement takes time, and I think you'll hear that from our speakers today. It is about relationships. It's about getting to know people. It's about a two-way interaction, and involving them. Feedback. I wouldn't be doing my job if I didn't say this is the number one bugbear. Public contributors, community groups want to know how they've made a difference. The importance of food. If you're meeting in person, make sure there's a cuppa or a biscuit at the very least. People often find that very relaxes people and gets people talking. And also, finally, have clear boundaries, plan your involvement, and make sure you know what people can be involved in your research and what they can't, so that they can be meaningful for you both and it makes a difference. And also have a think about what's your code of conduct, so that that people all kind of stick to the right behaviours, because it can be very emotive, some of the topics we cover in research. So just to be mindful of that. I will finish there. I hope I've been on time.
Perfect. 1 minute ahead. So we'll hand over to Dr. Flor Christie, please. Thank you.
Brilliant. Thank you, Kasia. That was so interesting. Thank you, Tracy. I'll just get my slides up. Can you see those in full screen? No.
Yep. Yeah.
Yeah. Do you see them full screen, or do you see presenter view?
Full screen.
Full
Brilliant.
screen.
Okay, wonderful. Thank you so much. So thank you so much for allowing me to talk to you today about one of my projects. I've run 3 very, very similar projects, but I just thought I would, for ease, just focus on one. So this is really just an example of how we use public involvement and community engagement. And so this is the ProCam-B study. This is about early diagnosis of prostate cancer for Black, African, and Caribbean men. This is funded by Prostate Cancer Research. I work with all of my projects. I work in close collaboration with the University of Glasgow, and in this one also with Teesside University. The actual problem, prostate cancer is now the most commonly diagnosed cancer in the UK. There are around 55,000 new prostate cancer cases in the UK every year, and that's projected to rise. And so they think it's around 17.5 100,000 deaths by 2038. So it's a really serious problem. It's even worse for Black, African and Caribbean men. They are twice as likely to develop prostate cancer and also twice as likely to die from it. So that's a real cancer inequity that needs addressing. Why there is that inequity, we don't fully know. There's lots of research investigating this. It's likely that there is a genetic element to that. But what we do know is that it's really important that Black men are aware of their increased risk and that they actually talk to their GP about, potentially having a prostate cancer test. There's very limited research in the UK about this. We do know from research in the US that there are lots of barriers to Black men to engaging with prostate cancer testing and also engaging with their doctor about this. So that's what we wanted to do, both in the northeast of England as well as in Scotland and particularly in Glasgow. We wanted to have a look at, so what makes it harder for Black men to engage with this, what might make it easier, then together in partnership with the Black community, develop an intervention to raise awareness of the risk of prostate cancer and to encourage uptake of healthcare behavior that encourages prostate cancer testing. Then we wanted to have a look preliminary at sort of, does this work? Does this intervention work? And we wanted to explore participants' views on the intervention. So people who took part in the intervention, what was it like for them? So that's what we were setting out to do. All my projects take a really, what we call Kasia just went over some of those terms. I call it a community-centered and participatory approach. So really working in partnership with the community. And I think one of the things that is unique about the way that we work is that we employ community recruitment leads. So these are members of the community. They are employed by the project part-time, but they are full members of the research team. So they are present at every research meeting. The voice of the community is ingrained in the projects. And these people are really our bridges between the research team and the community. So they're absolutely vital in terms of the recruitment, in terms of building trust with the community and really linking us. So they're really, really important. Then we also have a public involvement community engagement group, our PIES group, a really, really committed and dedicated group. You see them here in an online meeting because it's online because part of them were in Glasgow, part of them were here in the Northeast, where I am. But you can see that I'm not in that meeting and none of the white researchers are in this meeting. And this is something that we explored with them. We had 2 Black researchers on the team, and actually they preferred to have fully Black community, which they found easier to engage with and an easier and more comfortable environment to work with. And so that's what we did. We handed over that control and that they told us that they preferred that. And so therefore we really, really did that. Then in terms of our participatory approach, we co-designed the intervention. We worked really in partnership with them. What did they think, the intervention needed to look like? And then we also trained members of the community to help us lead that or deliver that intervention. So really to make sure that the intervention, the workshop is actually delivered by and for the community. So part 1, sort of looking at some of those barriers and facilitators. So really exploring what makes it difficult to go to a doctor for a prostate cancer health check. So all of the communities, we did this specifically with our PIES group, and all of them said that actually the community is not aware of the risk of prostate cancer. And so that's something that the workshop, the intervention really, really needed to address for them, that they found that really important. But they also told us that, for example, I'm sure that many of you have seen posters on bus stops around prostate cancer, and that 1 in 8 men are at risk of getting prostate cancer, which is actually not accurate. For Black men, it's 1 in 4. But they told us that that language that's used in those sort of health promotion messages wasn't for them. They weren't paying attention to it because actually they said, well, that's white men's language. We don't connect with that language. It wasn't necessarily about the English. It was just the wording that was used that wasn't appropriate for them. So making sure that the wording that we use is really, really appropriate for them is really important. They told us a lot about negative experiences of accessing healthcare. They told us about having to navigate gatekeepers, a GP receptionist that they found really, really difficult. They told us about experiences of racism, that they felt that it was much, much harder for a Black community to access this healthcare, to go to the GP, to make sure that they weren't seen as a burden and that they could actually access the GP. And there was a real sort of lack of trust in the system, but also in our healthcare system and also in our GPs, but also in our health promotion messages. And this is a quote from one of our participants. One of them said, "It doesn't seem to be like there's a logic behind this targeting, all this targeting, like prostate cancer is affecting more Black people. I don't understand." So that's a really important message for us to take on board, that message is perceived with distrust. They told us that it was really difficult for Black men to talk about such as sensitive issues, such as prostate cancer, that they really associated that with sexuality and manhood, and therefore it made it really, really difficult to talk about this. But they also talked us about things that could help. So, for example, a message around staying healthy for your family, particularly for your children, that would be really an important message to share. And that actually utilizing faith in a positive way, that for a really sort of religious community, that spirituality is really, really important for this community, that could be something that could be helped used in a positive way too. So what did we do then? Part 2 of our study, we then co-designed the workshop. So again, we had, after this, we used these barriers and facilitators, and then together with the men, we designed this workshop. Now, again, the white researchers were in the background, were not seen, but of course we do, see the transcripts and we do have some input, but it's all through our PIES group, through the Black community. So the workshop, the intervention, became a 2-hour face-to-face workshop with multiple components. First of all, the component is it's in small groups. The men talk about challenges to accessing a prostate health check, and that's all peer-led, so it's very comfortable. We have a Black GP who gives some health education with a Q&A. So what is prostate cancer, what is prostate, what is involved in prostate cancer testing. We have videos with testimonials from our community members discussing prostate cancer, so these are survivors. We have some activities to overcome some of those challenges with accessing healthcare, and also some particular questions to ask the GP. We have videos of 2 women talking about the importance of staying healthy for one family. We have videos of religious leaders talking about prostate cancer and the importance of looking after your health from a religious point of view. And then, of course, as Kasia said, we have food and we have music and a time to really connect socially. And the whole workshop is led by our trained peer facilitators. So our Black researchers are in the background to help with setup, but they are not leading the workshop. The workshop is completely led for and by the Black community. So what did we do? We delivered the workshop, first of all, in our first round in November 2023, both in the Northeast and in Glasgow, with 21 men. We then qualitatively evaluated that through focus groups, 14 men. We made some small changes based on that feedback, and then we delivered it again in February 2024, now with 41 men. And then we evaluated this qualitatively, and we had questionnaires before the workshop about the knowledge of prostate cancer and how they felt about engaging with the prostate cancer health test, and after the workshop to see if there was a difference. So a little bit about those questionnaires and the differences that we saw there. We saw that as men started to understand more about the personal risk of prostate cancer, their concerns increased significantly, and we would expect that as they got to know more about it, they also got more concerned about it. But they also believed much more than before the workshop. Afterwards, they believed that something could be done about it. So that's really important, and important in that message around early diagnosis. We found that there was a significant, massive increase in terms of knowledge, and also in terms of wanting to prioritize health checks and the intention to get checked. So we saw some big changes there, all significant, so really important to us. In terms of some of those qualitative results, so we took those together from round 1 and round 2, so in total with 39 men. The participants said that they really, really liked the workshop, but they're overwhelmingly positive, which was really humbling to hear, actually. They found it really informative, and so they got lots and lots of knowledge, which they found important, so that was really important. They also really liked the comprehensiveness, so all of the different elements of the workshop, the health education, the religious element, all of those different components they really, really liked, and they liked having all of those different pieces. They really liked the inclusion of survivors, and they felt that gave them hope. And that also, because those survivors were of the community, that really made it relatable to them. And so this is one of the quotes of our men. He said, lived experience, when somebody shares lived experience, it goes a long way to give you the impetus and say, I should go and get tested if he had the courage to do it. They also really liked the inclusion of women in the workshop. They found that really important. Women play a large part in organization of families, but they also just said something like this: if you want to convert a family, the first thing you do is you go and engage the women. And so they found that really important in terms of delivering that message and the importance of staying healthy for your family and for your children. All participants really described that they found it really important that there was a faith element included. They described it themselves as spiritual communities, as religious communities, and so the inclusion of that message of staying, that God find it important that you look after your health, and that you take responsibility of your health. They found that, and delivered by religious leaders, they found that really powerful. So that was really important to them. One of them said, honestly, I really liked what the 2 religious leaders said about prostate cancer, so that everybody would take good care of his health, of his body. So this is really supported by their faith. They really, really liked it that the workshop was delivered by and for the community. They felt it really created a really free and safe and comfortable environment. It allowed them to build trust, and they really felt that we had handed over control there. And comes back to Kasia's ladder of participation. They found that really important, and therefore they really valued that. One of them said, so having someone from our own communities talking about these issues and also having presentations with people from our community makes it relatable. And it helps us to actually understand the enormity of the issue that we're talking about. And therefore, it gets us to the place where we need to act. We need to do something about this. They really also liked having the GP in the room. They saw him as credible because he was a medical expert, so they found that really important. Interestingly enough, we have 2 Black GPs, one in Scotland, one in the Northeast, but the descriptions of the men were very, very similar, as if they were the same men. They said that they were really calm, really. They described it as, well, these men, as they are from our community, i.e. they are Black, they must have our best interests at heart. And so they found that really important. But also, they really liked the accessibility of the language that the GPs used. So they used really easy language, and this really refers to health literacy. It made it just really understandable for them, and therefore they could relate to it. One of them said, talking about a GP, he was calm and he understood every question that was asked, so he was able to respond accordingly. His use of vocabulary, he was not into too much of the ambiguous words. Being an expert, it brought everything to our level as laymen to understand. It's really important that we talk in accessible and easy to understand language. Many told in the qualitative evaluation, many of them talked to us about that they had already planned to go for testing, or they even had been. So that was fantastic to hear. One of them said, I've had my test actually. The following day I went to my GP straight away, and he laughed. And then many of them also talked about raising awareness in their communities, telling their brothers, as they called it, so telling their families about it, telling their friends about it, that they found really, really important. So in conclusion, I think it's really important that if we want to do something about health inequalities, we really need to listen to our communities. We really need to help to try to build trust, and we can only do that if we really work together. And that's the whole point of the workshop together, that we of today, of this session, that we really talk about meaningful public engagement. We really need to work together. We need to make sure that we involve members of the community, to make sure that the interventions that we aim to develop, that we involve them in making sure that those interventions are right from them, that they're culturally appropriate, that they speak for them. But in order to do that, I think we need to, as much as possible, really hand over control. And that's difficult for researchers to do, but we can do it. Yeah. In terms of our workshop, I think this really has, this way of working has got real potential, and I will use it, as I said, in other projects too. This particular workshop, we can't say yet that it works. More research is needed, and we need sort of effectiveness testing in a more robust way, but I definitely think there is potential here. And that was it. Thank you so much for your attention, and a big thank you to our really committed PICE group, our participants, and of course our funder. I don't know if we have time for questions now, or do we go to that later, Tracy?
We have 2 minutes if anyone has a quick question. Thank you, Floor. That was so interesting and wonderful to see how much effort you put into building the relationships, and, as you said yourself, sharing the responsibility and the power genuinely.
Thank you.
Any quick question from anyone? No, you've got some claps there.
Thank you.
Is that Lin Zheng? Would you like to come off mute and ask your question very quickly?
Sure, it was just a quick question to understand. As you mentioned, you had the community research leads and also the PICE or PIC group. I wondered how they were recruited and what the difference in their roles were, please. Thank you.
So the community recruitment leads are part-time. They are 1 day a week on the project. So they're really members of the community, and they are really members of the research team. So they are not part of the PICE group, but they're also involved in the PICE group meetings, but they are different. They are paid members of the research team, as am I, as perhaps you are, I don't know. And so in that sense, they're different. The PICE group is really our advisory group. So we have really regular meetings with them. They are paid for that, for that time, but those are sort of 2-hour meetings that we have every sort of, depending on the phase of the project, but it could be once a month, or it could be once every 2 months. So they have more of an advisory board role, if you like. The community the community recruitment leads are members of the research team. They are actively recruiting our research participants. So those are the people who take part in the intervention. Does that answer your question?
Thank you very much. Thank you, Flor. We will be able to take some more questions later. There's one in the chat, and we'll do that at the end, if that's okay, Ramos. So please, can we now hand over to Shabana Din?
Thank you. Thanks, Teresa. So if we just switch the slides to presentation mode. Thank you, Kasia, for sharing them. Thanks very much. Hi, everybody. So I'm Shabana Dean, and I'm the co-production and partnerships lead for Bradford Council's HDRC team. And today I'm going to talk a little bit about how we're using co-production within the Bradford HDRC team, with a particular focus on a youth ambassador programme that we have co-funded. So this programme is one where we employ young people to sit within the youth ambassadors services for 6 hours a week, and it's a paid role, and they act as a channel really for youth voice and insights for highlighting youth priorities and sort of feeding that into some of the decision making, and also taking some messages back out to some of the youth networks within the district. So the next slide, please. Thank you. So the HDRC worked with the Bradford Youth Ambassadors to look at what some of the emerging priorities were for young people to shape the direction of our work and to sort of, I suppose, help us to realise where we should be putting our resources. So one of the first things we did was we wanted to find out what matters most to young people and what their priorities were in the here and now. So we carried out a prioritisation exercise, and within that we looked at some existing reports and looked at the existing evidence to see what themes are emerging from some of the youth settings, from some of the other youth networks that we were involved with, and what are young people telling us about what matters to them in the here and now. So we synthesised some of the existing reports and looked at a whole range of different reports to look at what key themes were coming out on the wider determinants of health. And then we mapped these to Bradford Council's children and young people's strategies. What we identified was then was a range of themes that came up, but also some gaps. And this was that some of those reports were actually lacking the voices from some of the vulnerable groups of young people, and that they were also lacking some of the solutions to some of these challenges that young people were facing in the district. Next slide, please. What we then did was collated these findings into a report, and we went to the youth ambassadors and just sort of did a bit of a sense checking exercise that, well, this is what we're finding in the reports. Does this feel right to you from what you're hearing from young people and according to your experiences? And we shared this with the child-friendly lead that sits within Bradford Council as well. And based on the information that was given, 4 priority areas kind of were highlighted, and these were mental health and well-being, community safety, inclusivity, and employment and skills as the real challenges affecting young people in Bradford District. So the young people then carried out a series of research visits that were planned and co-delivered by them, by the young ambassadors, where they connected with wider youth voice groups to ask what could be done to address these challenges and what some of these solutions might look like. And this was all documented in a report. Next slide, please. The young people, the youth ambassadors, then organised a takeover event. So this was where they invited the Children and Young People Executive Board to a takeover event, which was planned by the youth ambassadors with support from the HDRC and the Children and Young People's lead in Bradford Council. So members of the board were invited to attend, and also the wider youth voice networks also came, and all these findings that had been collated, synthesised, and all the research visits findings were disseminated to the decision makers. So this was all the sort of people in attendance were people who had the I suppose the influence to be able to look at interventions and look at where resources allocated and look at how we can sort of implement some of these changes within our decision makings, within our strategies and within our policies. So what this event really did is it sort of raised the profile of youth work as well as the key issues and insights that were found and the solutions that young people told us would work for them. The event really raised the profile of youth work and of youth voice along the key issues, And it was kind of deemed a real success that they had this platform to be able to share their findings and to be able to talk about what matters most to them. And they were at the executive board actually agreed that it was so useful that this will now be a yearly agenda item on the young children executive board every year. So every year the young people will be able to collate insights in terms of what matters to young people, and to be able to have a yearly item on the agenda of the executive board. So there will be this continuous loop feeding in terms of what matters to young people, coming directly from young people. Next slide, please. So this is kind of just to reiterate, I suppose, what Kasia's mentioned and what we keep sort of saying in terms of the research cycle. And again, this is yet another iteration of what a research cycle can look like. And really, as a HDRC, our aim is to make sure that, again, we are working with people throughout the various stages of the research cycle. And I kind of just wanted to give a few examples in terms of what we're doing as a HDRC to ensure that we've got resident voice and resident what matters to residents throughout the research cycle, and how it sort of fits in with our work. So I suppose one of the first stages of the cycle in this particular example is the research question and the focus. So kind of, are we researching things that matters to communities, and are we focusing on things that people want us to focus on? So I suppose the previous example in the youth ambassadors, that's probably one example of focusing on things that matter to young people. But equally, we have a HDRC steering group for our co-production strand, and we have public contributors on that strand to ensure that we've got resident voice helping us to form and shape the co-production strand. And we also have the same public contributors who will be also leaning into the overall HDRC board, because I think what's really important about that is when you do have people on your steering boards is giving them enough background information to be able to know enough about your programme. And the HDRC, it's quite a new programme, it's quite a large programme with lots of different strands. It's important that the public contributors can feel they can contribute something to the discussions and sort of be able to shape the direction of the programme. So we felt having the same public contributors on the steering group, which is quite an operational group, and the HDRC board was quite a nice way of ensuring that we've got meaningful involvement on both of those layers. If we look at sort of research design methodology, again, any sort of work that we carry out with communities, we ensure that we've got public involvement opinions within that. So whether that's through our steering group public members, or whether it's sort of the youth ambassadors, obviously they co-designed some of those sessions previously. One of the next things that we're focusing on for the next cycle of our work is to try and find out what community priorities are for the adult communities within Bradford District. And through that, we are using very much a peer researcher, public contributor model as well, where we are selecting people from within those communities to help us carry out some of that insight gathering for us. Again, if we're looking at research study materials, it's really important that any questionnaires that we have are co-created to make sure that, are we going to get the answers that we're actually looking for? Are people understanding the language that we're using? So making sure that we've got that sense checked by people from the communities themselves. And again, the participant recruitment, it's essential to have local people with local knowledge in the role of a public contributor or community researcher who's able to tap in and let you know where those communities are, who are underrepresented, who are underserved, that we all know they exist, but making sure we manage to work with them for our work. So it's really important to work with people on the ground to be able to do that. Again, with the data analysis, when we synthesized the information for our youth priorities, we went back to the youth ambassadors and, sort of sense check the information with them, because sometimes research is carried out on topics that are useful to, I suppose, academics or perhaps a local authority, but it's not necessarily what the communities want. And sense checking it with communities is a useful way of finding out if it's what matters to people and if actually what was gathered was accurate according to their perspective as well. And again, we aim to use a similar model for our communities priorities work for the adult populations as well. And also we've got in terms of some of the dissemination, we've worked with the youth ambassadors to feedback that information, but we also have a plan going forward in terms of making sure that we do feedback to communities where we've engaged with them. So we have a whole host of summer activities planned where the youth ambassadors will be showcasing the work that they've done. But also we're hoping to produce a video on the youth priorities as a snapshot in 2025. These is what the priorities were according to young people that we can then share as a bit of an evidence base to policymakers, to researchers and academics. And we're hoping through our adult community priorities work that we produce a visual document in terms of the top 10 priorities, for example, for the adult communities in Bradford District across the 5 different constituencies. And we're hoping that if we do produce any papers, that they are also co-authored by our residents and co-authored by our public contributors. So just to make sure that we are meaningfully engaging with people throughout that cycle, and once we've built the relationships, to make sure we go back to them, not only to disseminate the findings, but also to include them in that dissemination process. And again, the long-term aim is that when we do get these priorities, they are then turned into research questions with our academic partners, and we go back to the communities who have told us what that those are those priorities, to be part of the research team, to be perhaps co-applicants, to be perhaps community engagement panels that can be included within the research process as well. So that's sort of the long-term vision of our HDRC. Next slide, please. So I was asked to include a quick slide about top tips, and I know Kasia's mentioned this already in terms of before considering time in a previous slide, but I would say in the local authority, double this time, because there's all the sort of considerations about how to engage with the communities and the processes it takes for that. But also coming from a local authority setting, what I found is that sometimes those processes aren't there, and you have to create those processes. And then obviously local authorities have their own processes that you have to work within, and that takes an enormous amount of time as well. So I'd say anytime if you think it's going to take you 6 weeks, perhaps 12 weeks is a bit more realistic, bearing in mind holidays happen as well. So that's probably one tip, because I think if you want to do things well, it does take time, and I feel like you ought to give it that time to make sure the result is worthwhile. Resources also, just consider we often hear in the local authority that there isn't any sort of resource or money allocated for public contributors or for some of the community engagement that needs doing. But I kind of want people to consider maybe, perhaps they are resources, but we probably just need to reshuffle them a little bit once we know what the value of co-production is. And I have a specific example where I spoke to a team who were within the council, and they sort of spoke about not having resources for public involvement, and we were sort of collaborating with a university for that element, which was great. But what they did say was that they'd outsourced an external agency for some of their evaluation, for example, and I sort of thought, well, there's funds for that, but there's not funds for this. And I'm just sort of, challenging people to reflect a little bit about perhaps there is a little bit of resource, and maybe we should value the resident voice as evidence to be able to allocate some of the resources that we have, and maybe shuffle that and set some aside for that very important element. And I suppose a third tip is that sometimes we don't know that, we always sort of feel like it's hard to connect with communities. We don't know where to find them, how to find them. But actually, within councils, there are many teams who regularly have grassroots links. For example, in Bradford Council, and I'm sure it's is the same for other local authorities, there are neighbourhood teams within the councils that sit under the area coordinators and ward officers that have real grassroots knowledge. And for my community priorities work, I've just gone straight to those teams and said, in your constituencies, where are those communities? How can I find them? What are your contacts? And it cuts so much of the sort of trying to find out different and new organisations, because I feel like the contacts usually are there. you know, so the advice would be use the existing networks that are already there and utilize the grassroots links to find those underrepresented and underserved communities within the district. And even within the public health teams within councils, you know, there's lots of community development work going on, and they will already be established links that people can then sort of go to and work with, rather than sort of cold calling on new organisations. So just to summarise on that. Thank you.
Thank you very much, Shabana. That was so interesting, and particularly to hear how you're using that research, that visual research cycle, to be systematic about the different ways and times that you can involve the community. Any questions from anyone for Shabana? I think I can't see any in the chat. As we've got a couple of minutes, Shabana, perhaps I could ask you a question. You talked about using existing resources and going to where you know there are people working at grassroots with communities, and a bit similar, I think, to what Flor was talking about, using them as brokers to the wider community. Can you maybe expand on that a little bit more with another example of how you've done that?
So I think in any sort of area, there's always this sort of large infrastructure organisations that have links to either member organisations or you know, there might be a VCS infrastructure organisation. And I think sometimes we find it so hard to try and connect with communities and trying to build new relationships when we don't have you know, the luxury of sort of lots of time. So I think it's really important to look at the landscape at a macro sort of level, that, you know, where are those community touch points and where do we have established links? So sort of always making sure that we use the existing channels wherever possible, and via those then kind of have a ripple effect into finding the micro organisations, the smaller organisations. Because I think if you try and look for small organisations in an area that you're not familiar with,
I think Shabana's sadly frozen on that point. I don't know if you want to come in there, Flor, and expand on how you've done that.
I think it's so important, but there she is, Shabana, leave it to her.
Apologies. Yeah. So one of the first things I did when I sort of joined Bradford HDRC was sort of create a bit of a macro visual for myself to look at where are those community touch points. You know, is it the Health Watch that has links to BCS organisations? Is it some of the organisations, you know, like the Race Equality Network we have in Bradford, which has over 80 member organisations? So just using those existing portals really and utilising them rather than going directly to communities and cold calling on them. I think that just works so much better, and it helps with the whole trust sort of challenge that we know we experience.
Thank you. And sorry, what were you going to say, Flor?
I can only agree with Shabana. I think it's really important what she says, is that cold calling is really, really difficult. And, you know, doors would close for me if I knock on those doors. And so it's using those existing community points, and they are there. It's really finding them and it's connecting with them, but doing that through the community, through, you know, powerful networks that exist that I'm not necessarily part of, but that I can liaise with. I think that's really important. But that's part of that sort of handing over a bit of control. Yeah, amazing. Lovely to hear, Shabana. Thank you so much.
Yeah,
Thank you for
thank you so much. Wonderful. And we're slightly ahead of time, so we can have an 11-minute. Well, let's have a 10-minute break now, everybody. Go and get a cup of tea, whatever you need to do, stretch your legs, and we'll come back on time for 11:10, if that's okay. So see you soon.
Tracy, for some reason, my camera's just stopped working, but I am here.
Oh no, sorry.
No, it's all right. I just thought, because let's see if it's gonna. No, I'm just gonna leave it off because for some reason, I don't know if anyone else has got this, but Monday morning
Right.
it's just asked me to
Do an update.
do a million that. At least I can speak, but I am here.
Yeah, you
Just
faded
so you
out
know.
slightly, but I can hear you again.
Okay, good.
Yeah,
Good.
yeah. So do fit, Kasia, do chip in if you want, because we haven't got any questions so far in the Q&A. So chip in if you would like to ask some or contribute.
Kasia, maybe the magical coming in and out, sort of, for me.
Oh,
yeah, I know. I just don't want to kind of then not be in it just because I'm sharing the contributor slides next. So I don't want to poke the bear on this one. If I wasn't, yeah. Although if Laura's there, maybe would you be able to share the slides if I leave and come back?
Yeah, that's fine.
Okay, I'll be back in a second, and hopefully all is well.
Yeah, fingers crossed she'll be back. Yes, I'd love to hear more, Flora, if you're able to share, if you have any role descriptions for the community engagement leads, that'd be really interesting to see, because
yeah, we do actually, and we're just have an HR project that just started, and we're just recruiting one for in Glasgow. So we have a role, but for every project, luckily I have sort of more time for them, because we find that 1 day a week is just not really enough.
No, but you get more evidence to sort of request more time to show the value. Yeah, that's great. Yeah, if you could, I don't know if you can share it on the chat, or we could share it when we send out the recording and presentations to participants.
Yeah, I'm going to find it.
You don't need to do it right now. Right, it's 11:10. So I'm hoping, yes, there's Rafe, and hopefully Rick will be back shortly. I'll just check that Rick is here. Are you here, Rick? Yes.
Yeah, I'm here.
There you are. Wonderful, thank you. So hope everyone had a nice break. And for the next half of the session, we have Rick and Rafe, who are both public contributors, who are going to talk about their experience and how they got involved in research as public contributors. First of all, we're going to hear from Rick Patake, who's a public co-applicant with the Medway Health Determinants Research Collaboration, which I'm sure he'll explain. And next, after Rick, we will hear from Rafe Hart, who is a public contributor who works with a charity that supports the needs of people, health and care needs of people of African and Caribbean descent. So and then following Rafe, we will have 10 minutes at the end where we will have time for questions. So it might be best for us to take everyone's questions there. So again, if you'd like to post your questions in the Q&A, that would be great. Thank you. So please, can I hand over to you, Rick? You've got your slides there.
Yep. Can you all hear me okay? Excellent stuff. So hi, my name's Rick Patake. I'm the Public and Patient Involvement and Engagement Lead for Medway HDRC. So that's the Health Determinants Research Collaboration, for those who don't know. And that's there's so many acronyms in this. So this is an NIHR, National Institute for Health and Care Research, funded program covering about 30 HDRCs across the country, and I'm right down in the southeast in Medway, part of Kent technically, but on its own. So I've been part of this program since about April 2022, so quite early on in the formation of it, even before it actually became a thing. So I was asked to be its co-applicant, looking at being asked to join after I was asked to join after a successful stint on another project looking at health amongst the overweight and unemployed community in Medway, and I was a part of a focus group looking at all aspects of the project, and that was my first foray into the health research. So I started as a co-applicant on the HDRC programme, looking at the application and making it more human and putting the public at the centre of the programme. I was invited to be part of the executive team as the public and patient involvement and engagement lead, and I'm now also the chair of our public advisory group, with full responsibility and for recruitment and meeting content. I'm also on a couple of other advisory boards within the HDRC programme. So my experiences, I don't have a research background, nor even a health background. I spent some time working with people with learning difficulties, and adults and children with mental health issues, but nothing from a research standpoint. So I come from a charity background, either helping those on the ground via external funding streams or as a trustee or chair of local charities. My knowledge comes from experience through these charities and through lived experience. So I'm part of the LGBTQ community, and I've faced discrimination and experienced health inequalities, not just in my life, but for those whom I've advocated for. I've worked and experienced homelessness. I've worked for homelessness charities and experienced homelessness. And I have some health issues, which, although not uncommon, do present as hidden disabilities. I've been chair of a couple of charities in Medway, and knowing the right people to direct those to in need to, this is what makes me a good fit for the PPI role, and I'm involved with now and has sprung from my involvement with it. So any challenges? There's loads of challenges. So as I've mentioned, I've no formal training to do this role, but I have knowledge from and experience from the charity sector. I've undertaken some PPI research training from the Centre of Health Services Studies, CHSS, based in the University of Kent, with Dr. Amanda Bates. She's the lead PPIE person and extremely knowledgeable in all things PPI. She's brilliant. I'm part of the Involving Research group there, and Amanda also mentors me. My main challenge, bizarrely, is me. So I have, because I've not done this before, and as a member of the public, sitting in a boardroom, technically, with professors and doctors and directors of health and public health, can be quite nerving, to be fair. So a lot of my challenges is in my head, imposter syndrome, anxiety, and just not being listened to. I've had experiences before where you're very tokenistic, and you're as a member of the public, you're tokenistic. It's a case of bums on seats, tick box exercise. We've all heard these expressions. Luckily, with the HDRC in Medway, and I think with the HDRC as a whole across the country, this isn't the case. PPI and public involvement is a crucial part of the programme. So that I'm really, really pleased about. Other challenges have been exceedingly rare and easily overcome. The main one being the demands on my time, as others who are paid in work either within the council or the university presume I may be available at the drop of a hat, which is sometimes not the case. I mean, sometimes you get emails and they just, can you just look at this? Can you just look at that? No, I'm out. So, yeah, looking at my time and not looking at my time as opposed to somebody else who's working is sometimes interesting. So another challenge is language. So so that's either academic language, acronyms, or abbreviations that people within the industry will use every day, and I haven't got a clue what they mean. I'm one of these people that isn't afraid to pipe up and ask, but there are times when you just go, I've not got a clue what people are talking about. So if you could have slide 2, please.
Oh, I think I moved it. Do you need me to move what is research? It says, is that the one you want, or is it the next one?
Yeah, what is research?
What is research? There you go.
So, so we spent with the Medway HDRC months, literally months, just defining the word research to make it understandable in all 3 settings. So that's the council, the university, and members of the public. It was quite traumatic, to be fair. As you can understand, research within a council setting is completely different to research within a university setting, and that's completely different to the perspective of a member of the public. So yeah, we spent ages. So this is very roughly what we came up with. In fact, it's not even roughly what we came up with. We came up with this, which I think makes research understandable. We also avoid the use of industry-specific terminology or jargon. Slide 3 shows my impression of silo working. And then slide 4 is my idea of what a gatekeeper is. Now, I do know that Flor mentioned earlier on about a gatekeeper, but I didn't know what a gatekeeper was, and my gatekeeper stems from Ghostbusters in 1984. So, yeah, although to be fair, I think an awful lot of that's the idea of a receptionist. So slide 5, what are my top tips for researchers? So I've split this into 2. So experience is not always academic. So my example here, I've said this quite a lot, is it's fine to have a member of the royal family talking about homelessness, but you'll get a better response from someone who's experienced life on the street and can talk from the heart about their lived experience. Acknowledge your PPIEs and the role they play. Treat them no differently than anyone else on your board or in a meeting. I've enjoyed being listened to and respected and being taken seriously as part of our HDRC exec team, being involved in decision making at the highest level and influencing policies and procedures. All this despite being a Joe Blogs member of the public and surrounded by professors, doctors, and program directors, as said earlier on. Projects should be run from the bottom up and not top down. PPI involvement should not be tokenistic or a tick box exercise. Next slide. Listen to the public voice opinion. They matter. again, listening to a clinician talking about heart disease is not the same as listening to someone with a heart condition and how it affects their daily living. Make sure your public contributors are rewarded for their involvement. This is primarily being recompensed for their time, but also acknowledged within meetings, on papers written and anything published, be it a policy or a research abstract. And try to use plain English documents where necessary. Remember that the national average reading age is 9 to 11, with about 10% of adults being lower than this. So keep it short and keep it simple. So I think that was fairly quick. I can talk, if need be, a little about our public advisory group, if that's helpful, or I can accept questions.
Thank you so much, Rick. That was really interesting and good to hear you raise the issue of the support that public contributors need to be able to contribute. Do we have any questions? There's none in the chat. In that case, we have a question from, is it Lynn from Oxfordshire County Council? Do you want to come off
yeah,
mute?
it's me again, if nobody else is going to jump in. Hi, Rick, thank you for that really informative talk. I was hoping to ask, because I've been to a fair number of meetings where we have had a community or patient representative attend, and I can totally get sort of what you're saying in terms of, you know, sitting, even for me, talking to like the director of public health, it's quite intimidating. So if you're come off the street, then I can for sure see why that would be potentially quite an intimidating experience for some. I wondered in that context if there is anything that you feel supports you to have confidence, apart from, you know, if you've been part of a group for longer, then hopefully they will build that trust with you. But is there anything that they can do, especially starting out, to help that relationship form?
I think I don't want to say dumb it down, but to use language and to use speech structures that are easily understood. Does that make sense? So if you're going to start talking about the qualitative versus quantitative research scenarios, then Joe Public has got no idea what a qualitative and quantitative research question is. So break it down and just say this is the doing part and that's the other side of it. And I mean, use the proper terms if need be, but yeah, just literally put it into language that is understood. I think our HDRC exec team at least have got it perfect. And when they're interacting with me or they're interacting with other members of the public, they do tone down the inner jargon and the industry acronyms, etc. It doesn't help that I've got so many letters in my job title that is just ridiculous. I've got half the alphabet in my job title, and the HDRCs are NIHR funded HDRCs, which, you know, again is a mouthful, and people just go give up after the first couple of letters. But yeah, making your language the same as theirs is absolutely fine. Does that make sense?
Yeah, it does. Thanks very much.
Thank you, Rick. Oh, we have another question from Claire.
Yeah, it's just more of a comment really, and then a thank you to Rick for a really honest account, really useful. I work in Cornwall Council Public Health team, and I sometimes sit on what are known as clinical reference groups, which have lots of quite senior doctors on, and even in my capacity, I feel intimidated sometimes to speak up. So I sort of can identify with that. And I do feel like as public health roles, we are there to do some of that, not interpretation, but actually sometimes I ask questions that I think other people in the virtual room might want to ask, because you know, people are using lots of jargon or rushing through things. I kind of do a bit of a sense check, both for my own benefit, but for other people in the room that might not want to speak up. On our diabetes groups, we do have expert patients and public participation. And to be honest, I find the things that those people say the most interesting and insightful, informative part of the meeting. So I'm absolutely, you know, recognise the strength of including people who live in the community and residents. And then just another, like just a quick sort of another example of a phrase that we kind of use in public health, and my brother called me up on it, like the use of the word toolkit. And my brother works in quarries in Cornwall, so you know, absolutely is there doing quarrying and stuff. And he said, Claire, why do you keep talking about toolkits? He was like, you don't use a toolkit, you don't use a spanner or a hammer in your job. And I'm like, yeah, absolutely, you're absolutely right. I just use that as a throwaway word, and you, in your world, it means a completely different thing. So it's a little bit of a silly example, but it's really important for me to hear from people who live and work in Cornwall, and understand and start from a place of understanding their world and their lives. So thanks, Rick. Your account was brilliant.
I think you're right that it is very important to read the room as well. So if there is somebody who's sitting quietly in the corner who you think have got a completely blank look on their face because they're not understanding, then it's your you're right to ask questions sort of on their behalf that you think that they're struggling with, or to even just say, can you just explain that for us, please? Yeah, thank you.
Thank you so much, Rick, and to Lynn and Claire as well for that really interesting conversation around a really important issue. And I think you're quite right, Claire. It actually, what you're saying helps all of us. You know, I mean, I've worked in research for, I don't like to say how many years. And actually the fact that you're standing up here today in a big virtual space with, you know, 60 people sharing your experiences is something to be applauded as well. Hopefully, if we have time in the Q&A at the end, I'd like to hear about the role of the mentor in terms of supporting you, but we should move on to Wraith now, if that's okay. So thank you, Rick.
Thank you.
So Wraith, would you like to take the stage?
There you go, Wraith. I'm
You're on
sharing your
mute.
slides.
You're on mute, Wraith.
Wow, how do I
There we
follow
go.
that? Oh, so that was very interesting, that Rick. So appreciate that, and I do understand quite a lot of the things what you have said. Now, just a brief. If you could go to the next slide, please.
Is that one okay, Wraith? Do you want me to go on to the next? Is that okay?
Yeah, next one, please.
Okie doke. Go. Introduction, is that okay?
Yeah, introduction, yes. It's not moving. I don't think you've got it in slide.
Oh, is it moving?
No, it's not. You haven't got it in.
Oh, let me try again. We were doing pretty well with IT, weren't we there? Let me try again. Slideshow.
Got it in full.
Tell you what, Laura Lewis, could you help me in case, because my camera's stopped working and maybe my slides have stopped working now. Could you share Rafe?
Yeah, of course, yeah.
Sorry, Rafe.
Okay, no worries. Whilst that's coming on, just like to introduce myself. I'm an environmental health and safety, occupational hygiene consultant. I deal with AstraZeneca, Pfizer, Houses of Parliament, all those areas. I deal with specialised chemicals and manufacturing. One of the things I've noticed since I've been in the role as a public contributor is that I do assimilate quite a lot of technical information. But since I've become a public contributor, I found out, like Rick, I'm a little bit lost with some of the abbreviations and a lot of the languages, what's being used. So again, I really understand where Rick's coming from, and that's one of the issues as a public contributor. If you have never been involved with research, or if you've never been involved in counselling or anything like that, it's a real milestone to sort of take on. And sometimes when a public contributor comes online, you really have to give them the best training possible. And that's where I'm coming from. The best training I received from a company or a section called Emory, who are now integrated into the NHS. So that was my first role. I'm looking at 3 roles today, one for the NHS, one for Emory, and then the last one was for the Leeds University. So the first one I went through was Emory. When I turned up, I sat down and I didn't have a clue what they were talking about. Not a clue. These 2 guys stood up and they were talking about 35 years of experience of doing workshops, doing presentations, and also one-to-one. Now, I think my one-to-one skills are pretty good. I think as well that my presentation is okay because I've done it for quite a few years with the environmental and also health and safety. So I've done quite a few presentations. But when it came around to actually talking about the information, what they were sort of presenting, it was very difficult to assimilate it and then rehash it and explain it myself. So that took quite a few meetings. We had about 9 to 10 meetings just to get the basics, understanding of what we were going to talk about, how we were going to present it, and also as well, how we were going to talk to doctors, nurses, counsellors, researchers, when you had no formal experience yourself. So again, the public contributor has to have that sort of eagerness and that enthusiasm to take on that role. And that's where the difficulty comes in, because some of us are shy, some of us are positive, some of it becomes very natural. But for those who want to get involved, it can be an arduous task for them. And sometimes they drop out because it's just too much. And as Rick says, what I found personally, I had to use a lot of my time, even though I was getting a contribution in funds, I still had to use a massive amount of my time to really get my head around it. I set up databases that I was the ones I was talking to. I set up databases for the training and go over the training over and over again, that when I was presenting, I was very confident about what I was talking about. And it's really crucial that the training, what you receive as a public contributor or a facilitator, is really important. And it has to come from the right type of people. Because if it doesn't, they won't be effective in the way they correspond with the researchers. Now, can I have the next slide, please? Next one.
So this one.
No, that's the one. So that was my first one. You've gone back onto, used to be full screen.
Oh yeah, no problem.
That's the one, yeah. So that was my first activity. And what we were supposed to do here, and I've got somebody on the group that understands what I'm talking about. We was going to present an all-day workshop. Do you imagine from day one, when I set myself up with SACNA and I went to volunteer for a couple of hours a week, I'm now being trained to do a workshop for 8 hours in a day to doctors, nurses, counsellors and researchers. So again, just thinking about that is scary. And I'm a quite confident guy, but it was really a scary thing because I stepped out of my comfort zone and I'm now in a zone where I was very unfamiliar with. So this was a challenge for me. I do like challenges and I was determined to be successful or to be able to present myself in a way that others could appreciate what I was trying to say. So we were looking at the researchers, nurses, doctors, council workers, administrators, and also as well, we talked a lot about the tender the procurement side of things. And the key thing about what everybody loved was about the life experiences. And there were 4 of us, what used to do 1 workshop in a whole day. And you imagine 8 hours, you'll think people get bored. But at the end, 99% of the time, we must have done about 10 workshops. And all 10, we got up to the 99% success rate of they've really enjoyed the day. So life experience is crucial because you can't replace it. You can talk about everything else, but life experience is such an important part of a public contributor. Because what it does, it reinforces what you're trying to say. It reinforces whatever research or whatever project you're working with. It helps you to understand, 1, how you can communicate with those from the ethnic minority, how you can ask the right questions without feeling uncomfortable yourself. And also as well, researchers really have to focus on how they can utilize a public contributor. For instance, they have maybe a translation issue. So if that translation issue is a problem, maybe a public contributor can help and also save the cost as well of employing a translator, what you might have to pay a lot of money for. And again, if we move on to the next one, because this was the first one, Emory, the second one was pre-crop. Now, this absolutely blew my mind because this was part of Liz Truss, who set this up 5 years ago when she was Prime Minister. And she was saying that each trust have to collate more information about their patients, especially about the one from the ethnic minority. So the project was in Sheffield, Manchester, and Leeds. I think I've got that right. Those were the 3 hubs, but they were testing this pre-crop. Now, for my part, I've never been involved with lightning reports, community research. So again, I moved from Emory, which I was still doing. I moved into this next project, which again tested my time and ability to the maximum. But it was so enjoyable working on these projects. I loved it, getting involved with something which I can contribute to and also help others to appreciate it. So the pre-craft is still ongoing. We're going on to the next phase of that, which is due to start in the next couple of months. And again, there'll be new sets of research, new sets of how to put the report together. On all of this, I'm having to learn from a good teacher, a good example of who's got the experience in the research and writing the lightning report. And again, we work well together. And again, that's another thing what you have to sort of make sure that you all can work together. Sometimes people have got stronger personalities than others. And if it doesn't sort of marry up very well, sometimes it can create divisions, and you can't afford to have that when you're working together. So the next one project I was involved with, which made me laugh, can we go to the next slide, please? The next one. Next one. This one here. I can't remember what her name was, but she was talking about toolkits, and I had to laugh because this is what I worked on in the Sheffield with the Leeds University. Now, what they're trying to develop is a toolbox that researchers can actually go on and ask particular questions. Now, I would agree that word toolbox, I've always known it. I've got one at home, got all the tools in. Unfortunately, I never get a chance to use the toolbox. But from my point of view, it is a very awkward term, toolbox. I do understand the mechanics behind it, because I did explain the reason why I refer to it as a toolbox. Now, that's going to be a platform where the public contributor, facilitators, academia researchers and researchers can go on, pose a question, and it will give you an answer. That's due to be on stream anytime now. So that's what's been developed to help us to do that. Also, thinking about the public the communicators and members, this particular book was released, a research handbook for patients and public involvement researchers. It's an excellent one. one of the best pages is abbreviations. It has all the abbreviations there that to help somebody like myself or anyone you're taking on as a new person will be able to help. It's got all kinds of hints. Perfect book for somebody who's starting out as a public contributor, researcher, or a facilitator. Really important that we understand that. Now, from my point of view, coming back to my experience, I've learned a lot. I've been in it now for 2.5 years. And the experiences what I've developed and the skills that I've developed has only come because of the training and the consistent backup from the mentors and other individuals what are trying to support. Without that support or framework, it's going to be very difficult for them to make progress and be able to stand on their own 2 feet, because eventually they have to stand on their own 2 feet. But again, working with the community, researchers have to really get involved with that. One of the experiences we learned from the workshops is that there was a little reluctance for researchers to go out into the community to understand what was happening. So they were happy to put the tender in, and most of them were saying that once they put the tender in, they didn't really sort of facilitate the costing of a public contributor or a facilitator or just the community as a whole. So when it came around to helping out, they then realized there was not enough money to sort of help those individuals. So again, that get put in the background. There's no effect in the community, and it's us against them scenario, which doesn't work. And as we heard earlier on from the doctor about the prostate cancer, how they've got the network, they're really working hard and getting the community in, getting individuals in, and it's hard work. It doesn't happen just by chance. It's all hard work. So a researcher with the support of a public contributor really helps that community to function very well. And any issues can be sorted out quite quickly and quite proficiently. So that's what I think about when I think about my role, that I can be a support, I can be a help. And when I put the effort in to understand what's happening, I can be very effective as well. But again, it takes up an enormous amount of my time. At the moment, I can do that because of my working situation. I was only meant to do a couple of hours a week, as I mentioned earlier, but we all know it's not a 9-to-5 job. It's a 24-hour job daily. But we all enjoy it and we all work together. And it's great that we can have forums like this, that we can help the researchers to appreciate how a public contributor really can be effective in his role. And I'd like to conclude with that. Thank you very much for listening to me.
Thank you very much, Ray. You'll see you've got lots of claps appearing on the screen. And yeah, thank you so much for your honesty and being so open about some of the challenges to being involved. Do we have any questions for Ray? I can't see everyone on the screen, so please come off mute if I can't see your hand. Nice.
I did see a question about the details for this book. So I don't know whether.
Oh, yes.
Yeah. So I don't know. I'll send the details afterwards. That
You
can get a copy of that.
Thank you, Ray.
It's literally just come out about 2 weeks ago.
That'd be brilliant. We do have someone raise their hand. Mandy, would you like to ask a question?
Hi, yeah, thank you so much, both of you, for sharing your experiences. It was really lovely to hear. And you mentioned, I think, mentoring and the importance of support from a mentor. And I wonder if you could just say a little bit more about how that worked and the kind of support that they offered and what recommendations you might have to others.
Yeah.
Thanks.
Yeah. When I was working on the pre-craft, which I still am, there was a researcher there who was excellent at her job. But what she had was a very nice skill of integrating myself when I was working on the project. And And I thought, that's a skill on its own. It's very difficult for everybody to have that skill, but she had that skill. And we worked together so well. And she taught me about research. She taught me about how to put a report together, and also the details, which she didn't need to tell me about, but she spent a lot of time with me, sitting down and going through it. And we went through it, and she said, Ray, I think I've got enough confidence in you to sort of do a report on your own. But what she did, every time we met, she spent 10 minutes, just 10 minutes, showing me areas of how I could improve and what's important for this report. And from that point of view, when a mentor is involved, it's really important that they have the time to spend with the public contributor and the facilitator, but also as well, that it's not just a job for them. They've got to have that bond together. If they don't have that bond, it's never going to work. So again, that's another hard work for the researcher to say, will that person fit with that person? I don't know, but that's one of the things I found. And I still work with her now, and it's a pleasure working with her. And unfortunately, we've just clicked together just naturally. So
That's brilliant. Thank you.
yeah, thank you very much for your question.
Thank you. I think that really came through in your talk, Rafe, which is the importance of taking that time to build the team and the relationships.
Yeah.
And that was something I think that came up in Floor's first talk as well, which is about the researchers actually listening to the feedback from the public partners, that they would be more comfortable actually if the researchers withdrew for some of the conversations. And it's about negotiating those kind of relationship, terms of engagement, if you like.
It's so important, that is. Yeah, it's really important.
Kasia, you've got your hand up.
Yeah, sorry, my camera stopped working. Obviously, perfect Monday morning. I didn't know before I'd do if Rick wanted to add to anything before I asked my question. Rick, you're on mute.
I'm on mute. So sorry about mentoring.
Yeah, I didn't know if there was anything from your before I ask another question.
I think with me, so I'm mentored by, as I say, Amanda from CHSS Centre for Health and Social Studies, Services and Studies, I think, in Canterbury University. So she's a PPIE lead, has her own research group that is made up of members of the public. They come and sit down and listen to a proposal and then tear it apart, as members of the public have the right to do. So they don't literally tear it apart, but we just look at and give advice on what will and won't work. So real public contributors. So she advises me or mentors me every 6 weeks. I've got a meeting with her tomorrow, bizarrely. And it's everything from how I'm feeling, how I'm should start saying no more often. I should stop being not in a nice way, stop being critical of myself. I can do these things and it shows, because I'm now being asked to do other stuff. But I also have meetings with heads of research, heads of operations within the HDRC. So I have regular half-hour meetings every fortnight with them to find out what progress I've done in the last couple of weeks, what progress they've done, and just general chat, really, just to not really mentoring at that side, but it is just like sort of keeping in touch and keeping in touching base, as it were. Again, another phrase that I don't particularly like, but we all know what it means.
Oh, thank you. Tracy, if I don't mind, if there's no other questions, I just wanted to ask one a little bit that maybe builds on this, but to Shabana and Fleur about the control thing, the control element of this, and maybe particularly in yours, Fleur, that you talked about kind of, giving up control. is that hard? How do you guys, you know, when the youth take over the council, Shabana, any advice for others who might think, oh, that sounds a bit scary? Any advice for researchers on the call?
I think, I suppose, what Rafe and Rick have spoken about is just to make sure that the people you're working with are heavily supported. We sort of follow the co-production Act Early strategy within Bradford HDRC, and it talks about sort of 3 underlying principles. So it's, I hope I remember them all. So equality, making sure that there's shared power. Agency, so giving people the skills to be able to participate meaningfully, so give them the tools, whether that's training, whether that's mentorship, support in actual sessions, hand holding wherever it's needed. And then a word that I don't really like, but it's called reciprocity, which is basically making sure that everybody benefits from that process. And that, I think that's where participatory community-led research is so special, because you know, within research projects, sometimes it takes a while for communities or people who are involved in the process to see that impact. But if people are benefiting from the process of the research, you know, whether it's recognition payments, whether it's upskilling, whether it's further opportunities to get involved, and doing things that interest them, I think that's really beneficial as well. So in terms of I suppose in answer to your question, yeah, just making sure that, you know, you're there sort of scaffolding that support and you're able to let go, just like in Wayne's example where his mentor sort of said, I think you're ready for this now. And I do think there is a bit of safety in numbers as well. So when Rafe spoke about the Emory Cultural Competency Training Delivery, Rafe and I were together, and then there were 2 other public contributors as well. So we had each other's kind of back a little bit as well. It wasn't just me standing on my own as a public contributor or Rafe on his own. So I think that really helps as well. So when I came into this role as co-production lead in the HDRC, I had a previous background of being a public contributor as well. So I kind of, you know, remind myself of what worked for me as well in terms of that sort of power dynamics, that confidence building. And I do think it's, I mean, Flor, you sort of demonstrated it in your project as well, that the community group wanted to speak without anyone else being there because they felt comfort in their own sort of circle. And I think it's important to always have that fair representation in those meetings to make sure the power dynamics are all good. So not just having one public contributor, to have a couple, because I think they can rely on each other for support, as well as the sort of mentorship from the researchers as well.
Amazing. So can I just, Kasia, in terms of letting go and letting go of that control. I am a bit of a control freak. It was quite hard at times, but ultimately that was the whole point of the project. If I were there and sort of still holding on to control, how was I ever going to make sure that that intervention was right for the community, as I'm not a part of the community? So the only way to do it was to hand over control, and it worked. And I think it's really important for researchers to see the bigger picture. If we really are true to wanting to improve, you know, wanting to develop interventions that are right for the community, we have to let go and we have to hand over control. There are, of course, you know, it has to fit within the project, it has to fit within the budget, within the time. So there are some constraints that you can just discuss with the group. But yeah, that handing over control, I think, is so valuable. I think for our PICE group, the reason why they were so engaged and committed was because we allowed them to take over control, and that was really powerful for them. They felt heard, they felt valued, they felt trusted, and so therefore it was incredibly important. Yeah.
Thank you so much, Shabana and Flor, for answering that important question from Kasia. Any other questions from the floor before we conclude this session? It's gone so quickly. I can't see any hands raised or any anything in the chat. So I think what I've taken from today has been, a really strong focus on that early engagement with communities and actually reaching out to the communities and working through people who already have those established relationships, particularly with the more underrepresented communities, and working with them and enabling them to be brokers, because as researchers, we otherwise, as you say, we're coming in as cold callers, and why would anyone trust us? And I really like the idea of paid community engagement leads that Flor suggested, and you've very kindly shared the details for that and the role description in case anyone else wants to have a go at that. And also to hear from particularly Raith and Rick about the importance of how we really value and support our public contributors, because you're offering your time as volunteers essentially. You don't have to do this, you're not employees like the rest of us. And how we need to be really sensitive to the fact that you're not necessarily available 9 to 5 as we are, and respecting boundaries and working with each other, team building, working out how we can actually deliver research together. Anything you want to add, Kasia, before we close? Would you like to just say a few words as our public involvement lead?
But just to say thank you to you as well, Tracy. I've just thanked our lovely speakers in the chat, but thank you to you as well, Tracy, for chairing this. And thank you to everyone for coming and listening.
Been very easy and a pleasure. And yes, I would also like to say thank you so much to our speakers. And we will be sharing the presentations and the recording and the chat following. And as I said at the beginning, if you have any feedback or any ideas for topics that you might like us to cover in future training sessions, we'd really love to hear them. And we are available to offer support and advice. We've shared the contact details, so please do get in touch. And the earlier you get in touch with us, the better. So if you're thinking of applying for a fellowship or funding through public health stream, get in touch with us as early as possible. And then we can also involve people like Rick, who's on our panel. He'll give you lots of great advice about how to develop those partnerships with the communities in your areas. So thank you very much, everybody. I think the sun's shining in the east of England. I hope it is where you are. And I look forward to meeting some of you in the future.
Thank you.
So we'll close there. Thank you. Bye.
Thank you.
Bye.
Thank you. Bye-bye.
Thanks,
Bye.
Rafe. Thank
Bye.
Rick.
Bye.
Thanks,
Bye.
Flo.
Thank you. Thank you. Bye-bye.
Bye. Bye.
Good luck with your
Bye.
good luck with this afternoon, Rafe, with your assessments.
No, this was the hardest bit of the day.
Oh, bless.
You did so
Thank
well.
You did fantastic. Thank
You
you.
really did well. It's brilliant.
I enjoyed that, actually. It was really interesting listening to the variety of different ones.